Have you ever woken up in the middle of the night and your hand is just completely asleep? You know that feeling, buzzing with what feels like 1,000 pins and needles? So you shake it out, you try to get the feeling back, hoping you just slept on it wrong? Well, for a lot of people, this isn't just some random thing. It's one of the classic signs of carpal tunnel syndrome.
And let's be honest, when you hear that diagnosis, your brain probably jumps to one big, scary question. Am I going to need surgery? That fear of the operating room is totally real. But is it where this story always has to end? Today, we are going to cut right through that anxiety and lay out a clear roadmap for treatment, step by step.
And hey, if this is your story, you are definitely not alone. Carpal tunnel syndrome is, by a long shot, the most common reason people get a compressed nerve. It accounts for a staggering 90% of all cases like it. That means millions of other people are asking the exact same questions you are right now.
So let's see if any of these signs ring a bell. That tingling, pain, or numbness, usually in your thumb, index, and middle fingers. How about symptoms that just seem to get way worse at night, maybe even waking you up from a deep sleep? Or maybe you've just noticed a feeling of clumsiness, like you're dropping your phone more often or fumbling with your keys. And then, of course, there's the classic flick sign, that automatic shake of the hand you do without even thinking about it, just to get some relief. Your body is sending some pretty clear signals.
Okay, so to really understand the solutions, we have to get a handle on the problem itself. So let's take a little trip inside your wrist to see what's actually happening in there.
What you're looking at here is the carpal tunnel. Now, it's not like a long train tunnel, it's actually a pretty short, narrow little passageway right at the base of your hand. It's made up of your wrist bones on the bottom and this tough ligament stretched right over the top, kind of like a roof. It's pretty brilliant design, really, but it's also a natural bottleneck.
And here's why it's a bottleneck. I want you to imagine trying to fit 9 tendons, those are the little ropes that let you bend your fingers, plus one very important nerve, the median nerve, all through that one tiny space. It's pretty much a traffic jam just waiting to happen.
So that median nerve is like a critical electrical cable that runs to your hand, carrying all the signals for sensation back to your brain. So at its core, carpal tunnel syndrome is really just a space problem. When anything causes swelling or inflammation in that tunnel, that delicate nerve gets squeezed. The signal gets all jumbled up, and that is exactly why you feel that staticky tingling and numbness.
So what's causing this big squeeze? Well, it's rarely just one thing. We all know about repetitive motions, from things like typing or using tools. But underlying medical conditions, like rheumatoid arthritis or diabetes, can cause inflammation all over your body. Even something like fluid retention during pregnancy can do it. Basically, anything that adds more volume or takes away space in that already crowded tunnel can set the whole thing off.
Okay, so now we get it. The problem is pressure. So let's talk solutions. And here is the fantastic news. The very first steps are often the most powerful, and they happen far, far away from any operating room. This is what we call the power of conservative care.
The strategy here is really simple. Just reduce the pressure. So, what's in our first aid kit? First, just changing your activities, finding ways to give your wrist a break. Second, and this one is a total game changer for so many people, is wrist splinting. By wearing a simple brace that keeps your wrist straight, especially at night, you stop yourself from curling it up in your sleep and pinching that nerve for hours. And third, for the short term, anti-inflammatory drugs can help bring down some of that swelling inside the tunnel.
All right, now for our evidence corner. Does this simple stuff actually work? Well, the data is incredibly positive. Studies show that just using wrist splints alone improves symptoms for nearly 8 out of 10 people. You combine that with an anti-inflammatory, and that number jumps up to 85%. The bottom line is this. For most people with mild to moderate symptoms, these simple steps can be the whole solution. But, for some people, splinting and changing activities just isn't quite enough to calm things down. And that's when your doctor might start talking about moving to the next step on the ladder, a corticosteroid injection.
I want you to think of this like a super powerful, targeted anti-inflammatory fire extinguisher delivered right to the source of the problem. The huge upside is that it can provide really fast, significant relief, which can feel like an absolute miracle when you're in constant pain. But, and this is a big but, the downside is that for a lot of people, the relief is temporary. Once that steroid wears off, the underlying pressure problem can just come right back.
And this statistic right here really helps set some clear expectations. While an injection is a great tool for short-term relief and even for helping confirm the diagnosis, the evidence shows that only about a quarter of patients get true, long-lasting relief from a single shot.
It's often more of a helpful bridge than it is a final destination.
Which brings us all the way back to the main event. After you've explored these other options, when does surgery actually become the right answer?
Now, this is so important. You have to see surgery not as a failure of other treatments, but as the correct treatment for very specific situations. So the green light for surgery usually appears when a few things are true. 1, you've given conservative treatments a real, honest try, and they just haven't worked. 2, your symptoms are severe and are really messing with your daily life. And 3, and this is the most critical part, when there are signs of actual nerve damage, like constant numbness or when the muscles at the base of your thumb start to visibly shrink.
And if you do get to this point, here's our second evidence corner. And honestly, it's a very reassuring one. The success rate for carpal tunnel release surgery is incredibly high. The procedure is pretty straightforward. It just involves cutting that ligament roof to create more space for the nerve. And studies show that about 98% of patients get relief from their pain and tingling. So when it's the right choice, it works exceptionally well.
So let's zoom out for a second and put this all together into your own personal treatment action plan. The best way to think about this whole journey is not as a single choice, but as a ladder that you climb one step at a time. And here it is, the carpal tunnel treatment ladder. You start on the very first rung with conservative care, things like splints and anti-inflammatories. This is perfect for mild or early stage symptoms. If you need more, you can climb to step 2, injections. This is for more significant symptoms that need rapid, even if it's temporary, relief. And only if your symptoms are severe or that nerve is in danger do you move to step 3, surgery. See, it's a logical step-by-step approach.
So to finally answer our big question, do you always need surgery for carpal tunnel syndrome? The answer is a clear, resounding no. For most people, the answer is found on the first or second rung of this ladder. The real question is, what's the right first step for you? Your next move is to have an informed conversation with your doctor, using this ladder as your guide. Because understanding your options is the first and most powerful step toward getting relief.